Here we have an email from Neil Ferguson to a viewer of the UK column, and we're going to go through a couple of the things that he's said here to explain or to comment on what he has said. So let's have a look at this in a bit more detail. First of all, he says, you will see that there's been a large spike in all-cause mortality. Now, when he said that, he was referring our viewer to the Euromomo website. So he said, you will see there's been a large spike in all-cause mortality, far above anything seen in recent years, in a context where all of Europe has put in place large-scale social distancing, even Sweden, although their data isn't on that site. Well, I'm really going to ask a question here. Is Neil Ferguson aware of what's on that site? Because, of course, Sweden absolutely is on the Euromomo site, and the evidence from the data on the Euromomo site from Sweden shows that they didn't have anything like the spike that other countries in Europe had, particularly not by comparison with England in particular. Ferguson in his email went on to say this, the key thing all the models show is that had it not been for the controls introduced, the impact would have been a lot worse. Well, I think we've seen from the non-lockdown versus lockdown graph that we showed just a few seconds ago, that's not the case. Of course, what he's talking about is what the models are showing, not what the reality is. So I think there's some questions to be answered there as well. And he went on to say this, probably 50 to 70% of these deaths are COVID, and 30 to 50% are from people dying from other things because healthcare is overloaded or people feel more reluctant to go to hospital. But is healthcare overloaded? Because certainly people working in the healthcare business seem to have lots of time to take photographs of them dancing around and so on, at videos and posting them on social media and so on.
And we know from the reports, Mike, coming in from consultant level in the NHS to senior nursing staff to other people employed in the NHS that the wards are operating at very, very low capacity. We know this.
Absolutely, and I had another report from Exeter yesterday from a consultant there saying that they've got nothing to do. So really, it's this last section here where he says, or people feel more reluctant to go to hospital. It seems to be acceptable to Neil Ferguson that people would be in a position where they feel more reluctant to go to hospital. This is because of the mainstream media headlines pushing the notion that this is an extremely contagious, extremely dangerous disease, and that people are going to die if they come into nearest contact with it. People are then left with a choice. Do I go to hospital with the heart attack symptoms or the stroke symptoms that I'm experiencing at the moment and potentially get COVID on top of that? Yeah. Or do I try to keep going at home, which of course is resulting in people dying at home? So let's just have a look, just remind everybody what the situation is with this, because it's the latest Office for National Statistics numbers which came out yesterday. Well, we can see that the peak, we seem to have gone over the top at last. But if we actually take into consideration the COVID-19 attributed deaths, then it's the dotted line here, leaving this shaded area as being the difference. So that represents non-COVID deaths, in other words, deaths that have resulted from the lockdown. And that appears to fit with what Neil Ferguson said in his email. 30 to 50% of the people that have died, the excess mortality in the last 4 or 5 weeks, has been as a result of the lockdown. That's what he has acknowledged there. But the question is whether these deaths that are attributed to COVID-19 were actually as a result of COVID-19. And there's a difference there because, as we've mentioned before, when you go back to the Italian statistics, there we had Professor Walter Ricciardi, who's the scientific advisor to Italy's Minister of Health. And the quote that the Telegraph put out was, on re-evaluation by the National Institute of Health, only 12% of death certificates have shown a direct causality from coronavirus, while 88% of patients who have died have had at least one pre-morbidity. Many had 2 or 3. So this is slightly speculative, but if we put that 12% onto this particular graph, then this becomes the number of deaths excess deaths as a result of the lockdown, not the previous one. I suspect the truth is somewhere in between.
Yeah.
But nonetheless, nobody is addressing this in the mainstream press, and we just say it again, it has to be addressed.